Live webcast of this entire event in both audio and video, and so it does take some time, and we appreciate your patience in letting us begin a little late. And we're very thankful that you're here. First of all, I'd like to welcome you personally. My name is Norman Horn, and I help lead the Libertarian Longhorns here at the University of Texas at Austin, and we are helping sponsor this event, which is the Vaccine Education Forum. You're here to listen to a debate from both sides of the argument because we believe in our group and in all the groups that co-sponsor us, who I'll mention in a moment, that to be fair and balanced, we do need to hear both sides. And so we're glad that you're here to participate in this, and you'll have an opportunity later on to ask some of your own questions. And we do encourage you to make sure that even if your emotions get a little high, to make sure you remain civil and be fair and balanced ourselves. Because again, if we expect our people up here to be fair and balanced, and we expect you to be fair and balanced as well. I'd like to give a little credit to our other organizations that are helping sponsor this. Like I said, the Libertarian Longhorns have been very helpful to me in assisting in organizing this event, but we also are proud to welcome the Objectivism Society, and Alan McKendry is in the back here. He's been one of our contacts. We thank them. The Health Professions Council has also been instrumental in making this event happen, and also the College Republicans. And so as you can see already, this is not a one-sided deal by any means, but also we're including many different points of view. I'd also like to acknowledge Texas for Accountable Government for being here as well. We're thankful that they're with us. And so with that, I would like to introduce our moderator for this evening, Dr. Donna Campbell, who will be directing us in the debate. Donna?
Thank you. Good evening, ladies and gentlemen. I'm Dr. Donna Campbell. I'm a physician. I've worked in both ophthalmology and emergency medicine, and I'm the medical director to emergency departments. Like most people, I'm concerned about the future of our healthcare, our public healthcare policies, and I am concerned about the impact it has on our daily life. I'm excited to moderate tonight's Vaccine Education Forum, which will debate the question, are vaccine mandates good or bad for public health? As you know, recently, the Secretary of Health and Human Resources, as well as President Obama, have declared the H1N1 virus as a public health emergency. These actions actually invoke law that could lead to mandatory vaccinations of the general public. While vaccines have been credited truly for eradicating many deadly diseases, there are several organizations across the United States that have successfully sued or are suing state and federal government in order to prevent forcible vaccinations on the grounds that the vaccine has not had adequate testing for safety. Tonight, we will debate these and other relevant issues that revolve around this important public health policy. Once again, we are very grateful for the University of Texas sponsors, which include the Libertarian Longhorns, the Health Professional Council, the Texas College Republicans, and the UT Objectivism Society. And thank you all very much. Joining us are panelists, Dr. Tom Betz. He is the Regional Director of the Texas Department of Health Services, Region 7, and he is speaking in support of vaccine mandates. Speaking in opposition to the vaccine mandates are Dr. Sherry Tenpenny. She is the founder of OsteoMed 2, which is an interactive medicine clinic located in Cleveland, Ohio. She has many other credits to her long list of things she's done, but I'll leave it at that. Dawn Richardson is president and co-founder of PROVE. This is a group that stands for Parents Requesting Open Vaccine Education, and it's here in Austin. She's also the director of state advocacy for the National Vaccine Information Center in Vienna, Virginia. We did try to have a balanced panel, but despite our best efforts, we were only able to find two panelists on the side opposing mandates and one that is for mandates. Still, we will have a balanced debate allowing both sides to to rebut the issues. In our first hour, the panelists will be allowed to first introduce themselves and express their position on the issues. This will be followed by 2 question and answer periods. The first period lasts about an hour, and I will be directing questions that I've selected to each panelist. They'll each answer for about 3 minutes, and there will be a 1-minute rebuttal. In the second hour, that's your turn. We'll have you line up in the aisles. We will ask you to give your questions. You will have 1 minute to ask your question. The panel, whoever you direct the question to, whichever panelist, they will have 3 minutes to answer your question, and there will be, again, a rebuttal of 1 minute. Now, let's get to know our panelists. You each, again, have 4 minutes to introduce yourself. Why don't I start with you, Dr. Tenpenny?
Thank you. Thank you for the introduction. Okay. And good evening, and thank you all for coming. And thank you all for all of the people who organized this for bringing me down from Cleveland, Ohio tonight to be able to participate in this really wonderful opportunity. I'm a physician in Cleveland, Ohio. I'm board certified in emergency medicine through 2005. I'm board certified in manual osteopathic medicine. I have a clinic in Cleveland that's been there almost 14 years. I got involved in the vaccine information awareness movement back in September of 2000 after attending the Vaccine Information Center meeting in Washington, D.C. And since that time, I've personally spent nearly $9,000 of personal research. I've written 2 books, put together 2 DVDs, and I've spoken at a lot of meetings like this across the country. I'm probably one of the few physicians who spent an awful lot of time researching problems associated with vaccines and bringing it to the forefront so that people like you and people who are watching this can choose for themselves and have a very open dialogue about informed consent and know the other side. So I want to thank you for this opportunity to openly discuss the pros and cons of vaccination in this forum. To my knowledge, this has only been done once before, and it was a radio program right here in Texas. Young people today are smart and savvy. If you were born between 1978 and 2000, your social group is now being called the millennials. Millennials as a group are politically, socially, philosophically independent. Your group will lead the sweeping change needed in America and around the world. Your group will make your own decisions about getting vaccinated and allowing your children to be vaccinated. You're not going to take the word of a bunch of baby boomers. You will Google it if you haven't done so already, and you'll figure it out for yourself. In 1985, there were 3 vaccines, and children received a total of 33 vaccine antigens when they got all the shots before entering kindergarten. But if a child is born today and receives every recommended dose of every vaccine, the child will receive 113 vaccine antigens and measurable amounts of chemicals by the time they start school. It doesn't take a master's degree or a PhD to understand things have changed, and so has the health of the children in America. As young, responsible adults, will you continue to believe the safe and effective mantra about vaccines, once it is widely understood that safety studies are short and effectiveness has little or nothing to do with protection from illness? Will you conclude that suppressing outbreaks of chickenpox with vaccines is worth creating an epidemic of shingles in older adults? Will you agree that suppressing outbreaks of measles is a fair exchange for an epidemic of chronic illness and autism? Will you conclude that there are healthier, more natural ways to keep healthy during the winter instead of getting a flu shot? It's been demonstrated that health is an inside-out phenomenon. If we have adequate vitamin D and vitamin C, if we eat good food, drink purified alkaline water, get some exercise and get plenty of sleep, the world of viruses and bacteria that we swim in will leave us alone. As a board-certified physician, I've invested more than 9,000 hours into the down and dirty about vaccines. I've come away with a studied opinion, not just a personal opinion, but a studied opinion that vaccines are not safe, not nearly as safe as we've been led to believe. They offer little or no protection, and they can cause serious harm. So thank you for this evening. I hope that you enjoy the exchange, and I look forward to your feedback on my Facebook page at drtenpenny.com, and I really look forward to your questions when it's the second part of this presentation. Thank you, Dr.